Hello and welcome to the Concentra webinar, Managing the Hidden Risk of Work-Related Asthma. Today's webinar will be presented by Dr. Ronda McCarthy and Dr. Deepa Rajakrishnan. Dr. McCarthy is Concentra's National Medical Director of Medical Surveillance Services and a nationally recognized expert in occupational medicine. Dr. Deepa is the Director of Medical Operations in North Texas, overseeing more than 30 clinicians to ensure quality care in Concentra medical centers. At the conclusion of the presentation, we will have a 10 to 15 minute Q&A session with Dr. McCarthy and Dr. Deepa. You can submit your questions throughout the presentation to be answered during the Q&A. They will answer as many questions as possible within the time allowed. A recording of the webinar will be emailed to you after the presentation, as well as a copy of the slides, so you can view it again at your convenience. Dr. McCarthy, Dr. Deepa, we're ready to begin.
Well, thank you very much. You can move on to the next slide. Thank you everybody for joining us today for this webinar. In this webinar, we will be discussing the definition of occupational asthma, how much of an impact it is on the workforce and the community in general. We will also walk through steps on how to screen for occupational asthma and what you as an employer can specifically do. We will also talk about how increased awareness is essential so that this is identified early to help reduce the burden on the employees. Next slide, please. Just a few quick points to help everyone orient towards what asthma is. It is a disease which affects the respiratory system, specifically the lungs. Causes the inflammation of the bronchi, which are essentially the tubes connecting the lungs to the nose and the mouth. This inflammation causes difficulty in breathing. The usual causes of this inflammation are either an allergic reaction to a substance or the lung tissue developing an increased sensitivity to the offending substance. Asthma is very different from obstructive lung disease like COPD, etc., because it is reversible. The inflammatory changes may be reversed with proper management. Next slide, please. Now, diving into occupational asthma. When asthma is caused by specific agents in the workplace, it is referred to as occupational asthma. Similar to the guidelines for managing asthma, occupational asthma is also a reversible condition, which means when the substance that caused the inflammation are avoided, symptoms may disappear. Next slide, please. It is estimated that there are more than 300 substances in the workplace that may either cause asthma or cause worsening of pre-existing asthma symptoms. We have to remember, even though there are around 300 substances used in the workplace, this list is not complete. New materials and new processes introduce new exposures and create new risks every day, and they continue to be added on to this list. The Occupational Safety and Health Administration, OSHA, states that every year about 11 million employees are exposed to one or more of these agents, thereby increasing the incidence of occupational asthma. Some examples of these substances are plant-based soluble fiber, animal and animal byproducts, formaldehyde, latex, isocyanates, wood dust, chemical fumes, chromium, and other chemical compounds, including cleaning supplies. Next slide, please. Here are some interesting facts, more so to stress the impact of asthma, including occupational asthma, and why it is important to recognize it and take actions to prevent it. Number one, spanning about 17 years from 1999 to 2016, about 33,307 adults have died of asthma. And it is estimated that about 21% of these deaths were attributed to work-related exposure and hence potentially preventable. Number two, it is estimated to cause about 8.7 million lost workdays due to sickness due to occupational asthma. And number three, adults with asthma go to the emergency department for treatment 2 times more often than those who do not. They're also hospitalized at least 4.6 times more often. Next slide, please. Work-related asthma can be further divided into two categories based on occurrence. Number one is the work-exacerbated asthma. These are employees with pre-existing asthma but experience a worsening of asthma symptoms at work due to exposure. The second kind is the new onset occupational asthma, where asthma is caused by specific agents in the workplace. The National Institute for Occupational Safety and Health, NIOSH, states that asthma symptoms can develop shortly after exposure, or they can develop months or years after repeated exposure to harmful substances. Let us look at some examples for both the categories. Next slide, please. This is an example of a worker with work-exacerbated asthma. This was a 39-year-old man who had asthma prior to starting work with an auto manufacturer. Even though he had asthma prior to starting the job, he did not have any symptoms. He was a smoker and was obese, but nothing of concern came up during his annual checkup. His job involved dye design, machining, grinding, injection process simulation, and inspection. About 6 years after starting this job, he developed a cough and then developed difficulty breathing. He started going to the emergency department for difficulty in breathing, and a year later he died, and the cause of death was work-exacerbated asthma due to exposure to styrene, which is a chemical used in the injection process. He was 47 years old when he died. Next slide. Next is an example of occupational asthma. A laboratory which was handling animals hired students as lab technicians to work at their facility. The median age for the students was 21. There was a total of 38 students, and they underwent preliminary examination during their first year of training. After an average of 18 months of working with the lab animals, they were all reevaluated. And we found that 9 students, about 24% of them, had developed allergies due to lab animals. Symptoms they exhibited included nasal and eye irritation, skin rashes, and chest problems. Of the 9 students with animal allergies, 7 had reactions to rat or mouse antigens, and 8 of the 9 showed asthma-like reactions during lung testing. Next slide, please. Given the 300 plus substances which can cause occupational asthma, the prevalence is across several industries. Some of them are increased risk, and they are construction, manufacturing, food processing and production, transportation, oil and gas extraction, healthcare, textiles, cosmetics, and pharmaceutical industries. Next slide, please. Occupational asthma can be avoided with awareness and vigilance. NIOSH states worsening asthma or new onset asthma in an employee should raise concerns about workplace causes. Protecting employee health is certainly a compelling reason to mitigate occupational asthma. This would involve effective employer controls and medical screening. Next, Dr. McCarthy is going to talk about how these critical measures go a long way in helping to avoid the development of occupational asthma. Dr. McCarthy?
Thank you, Dr. Deepa. As Dr. Deepa relayed earlier, asthma is a disorder of the airways that involves a complex interaction of airflow obstruction, bronchial hyperresponsiveness, and underlying inflammation with increased airway responsiveness. This can result from an allergic, hypersensitivity, or irritant response to a substance after a one-time event or years of exposure to the substance. Let's look at why medical screening employees for signs, symptoms, and sensitivity to workplace asthmagens or substances that can cause the development of asthma is important to prevent unnecessary illness and associated costs. Asthma symptoms consist of one or many of the following: cough, difficulty breathing, shortness of breath, wheezing, and chest tightness. Symptoms may also be associated with nasal congestion, watery eyes, and skin rash, as Dr. Deepa alluded to earlier. Early symptoms of asthma may start with a clearing of the throat and slight chest tightness, that may be ignored by the employee until patients become more severe. This is where medical screening of employees exposed to known asthmagens or sensitizers can play an important role in identifying the employee with early health effects. Ways to confirm and document the health effects include immune and lung function testing. For some workplace substances, such as formaldehyde, chromium, diacetyl, OSHA requires medical surveillance examination. Laboratory animal exposure can require medical surveillance of exposed employees in order for laboratories to meet certification standards. Other employers find that post-offer examinations and periodic medical evaluations help decrease the direct and indirect costs associated with work-related asthma and allergy illness while optimizing employee health. Next slide. Let's walk through a typical medical evaluation for a substance known to be highly sensitizing, like isocyanates. Isocyanate comes in a few forms. It is a chemical used in construction and manufacturing. Ideally, employees medically evaluated for baseline and ongoing periodic health surveillance will have a complete health history and screening for their occupational history and asthma and allergy symptomatology to thoroughly evaluate past and present occupational history and past and present allergy and asthma symptoms. The physical exam will focus on the health effects specific to the chemical exposure. And specifically for asthma and allergy, we have the upper and lower respiratory system, cardiovascular to ensure there's not other complicating factors, and the skin exam. Testing common to isocyanate evaluation and other sensitizing substances include baseline spirometry or lung function testing and the chest x-ray. Subsequent periodic examinations should include all that we just discussed in the evaluation to monitor their respiratory health over time, except the chest x-ray is ordered only as indicated. Next slide. If the evaluation indicates that an employee has become sensitized or developed signs and symptoms of asthma, additional testing can be ordered. The evaluating healthcare provider will review all prior records. A bronchodilator reversibility testing can be ordered. This is a test to document asthma or reversible airway disease. An employee cannot be diagnosed with occupational asthma if they do not indeed have asthma. So once the bronchodilator reversibility test is performed and it's shown to be positive, peak flow testing can then be ordered to look for an occupational trigger at the workplace. The information gained from the medical surveillance, including the medical evaluation, the lung function testing, may lead to early detection of health effects. Detecting health effects early allows for earlier management, adjustment of employer controls, reassignment away from the exposure, that specifically isocyanates in this example, or other measures. And this is crucial as isocyanates, specifically sensitivities associated with severe occupational asthma, and that may lead to death, even when the exposure is lower than OSHA's permissible exposure limit. Next slide. So what can employers do when working with potentially hazardous substances? Next slide. Here we show NIOSH's an example of NIOSH's hierarchy of controls, which continues to be one of the best protocols to guide employers on how to decrease or eliminate the harmful health effects associated with hazardous exposures. The first option is to eliminate the hazard or substitute for a less hazardous one. The next is installing engineering and applying administrative controls to reduce or restrict the exposure. The last on the hierarchy is personal protective equipment, usually respirators in this instance, and they are best when used correctly and worn correctly. Employees can also offer medical surveillance and screening to employees to complement the hierarchy of controls. Next slide. Medical surveillance programs monitor an employee or a similarly exposed group of employees over time. This provides feedback to the employer on their engineering and other worksite controls. It evaluates employees for fitness for duty in the work environment, working with specific hazards, and screens employees over time for potential health effects related to the potentially hazardous exposure, so early intervention can occur. Next slide. Occupational or work-related asthma is an underrecognized risk, and increased awareness and communication can help prevent disease, disability, and death. Next slide. Current research reports that many patients, employers, and healthcare professionals lack awareness and underreport work-related asthma. This decreased awareness contributes to delayed diagnosis and poorer outcomes. Next slide. Basically, there needs to be better communication about asthma in general among employees and healthcare providers. Next slide. It is important for all healthcare providers to ask questions regarding home and work exposures when patients present with signs and symptoms of asthma. Most importantly, when these symptoms are new and mild. Next slide. Unfortunately, employees may feel early or mild symptoms do not warrant seeking medical attention. They may not associate their symptoms with work, but feel it's age-related, physical deconditioning, or related to seasonal allergy symptoms. There may be time pressures or fear that may interfere with reporting their symptoms until the conditions become unbearable. This is where periodic medical screening is crucial to detect early and potentially reversible disease when exposed to occupational asthmagens. Next slide. There are direct and indirect costs of misdiagnosis. The indirect costs include decreased worker productivity when asthma is uncontrolled, lost work days, workers' compensation expense, and disability costs. The direct costs include treating the illness, medications, office visits, emergency department visits, and hospitalizations, as Dr. Deepa mentioned earlier, and the unmeasurable cost of occupational asthma resulting in death. Next slide. To address these costs, and most importantly, the health of employees, Concentra has taken steps to ensure the consistency and the visibility of our occupational and allergy asthma services nationwide. We have added new tests, allergy and asthma medical evaluations, and clinician training to ensure optimal diagnostic services and care. We are raising awareness through communication, such as this webinar, information materials, and articles. An example of an article published last month is shown above on the left in Construction Executive. So thank you for your attention on this important topic for the health and safety of your employees. Now I'll pass it back to the moderator for any questions you may have. Thank you.